So once hypertension has been diagnosed, the first step is to talk to patients about their lifestyle and see if they are doing anything that they could change and not do, or perhaps something that they could start doing that would help lower their blood pressure. Depending on the level of the blood pressure, the age of the patient, and other medical problems, we may try a lifestyle first approach to lowering blood pressure. This is often appropriate in a patient who's first diagnosed, whose blood pressure is not real high, and perhaps has some risk factors to adjust. And we'd recommend a low sodium diet, a diet that is rich in potassium and calcium, something like a DASH diet, the dietary approach to stop hypertension, which is a diet that's high in fruits and vegetables, low in meat, high in calcium. All of these things, increasing physical activity and losing weight if the person is overweight. Over a period of several months, this often can lower the blood pressure pretty substantially, and in somebody who has a mild elevation may be enough. For that individual who either has an initial high blood pressure that we don't think that lifestyle will be enough for, we still recommend those lifestyle changes, but we may need to initiate medical treatment or pharmacological treatment. We use, the one thing that's great about our armamentarium for hypertension is we have so many different classes of drugs that we can use that are effective. And often these drugs treat other conditions as well. And so we choose a first drug for a patient based often on other things that they have going on with them. For instance, if they have migraine headaches, we might choose a calcium channel blocker or a beta blocker, because that might not only lower blood pressure but also treat the headache. If they are diabetic, we might try an ACE inhibitor or an angiotensin receptor blocker type medication. Or if they're an older woman, we might try a diuretic first. So depending on that individual and what we know about their other medical problems, we can choose often first a single or more frequently now starting with 2 medications. We often will need 2 or 3 antihypertensive medications to get good blood pressure control, and patients should not view this as a failure, and in fact well over half of individuals will need at least 2 medications to get blood pressure control. It's actually a good thing. Instead of using very high doses that might cause side effects of a single medication, we use the best of 2 complementary medications at low doses and get a better effect with lower side effects.